Go live and we'll start there.
Yeah, you're live now. Should be live.
Hello everybody and welcome to today's catch up with the executive team. We had the first of these yesterday and we've got another one tomorrow, and then we've got our usual connected session on Thursday. Just trying to up the amount of communication so we give people as much of an opportunity as possible to engage, raise issues. And on that, first thing I want to say is I'm really keen that people do keep raising issues. Inevitably, I know people are really busy, but we can't help you unless we can hear about things like IT shortages or equipment shortages. And please keep concerns coming around patient care, either through the Datix formal route or informally through to us. It's really important we all keep hearing and sharing what's going on in the hospital. Second thing I just wanted to say is we are acutely conscious on the exec team how tough it is. I know that there are a few positive signs in London that things might be plateauing a bit in terms of cases and hospital admissions, but it doesn't feel that way here yet. And if you look at some of our forecasts, realistically, we always say we're a couple of weeks behind London. That's what it feels like. So I'm afraid we're facing up to at least another 2 or 3 quite tough weeks, for which I'm incredibly grateful for what everyone is doing. I went down earlier to visit the volunteers in the fit testing station, and it was fantastic to hear about their enthusiasm. And I'm also really grateful for the over 50 members of staff who have volunteered to help patients at mealtimes. So if you still want to volunteer, we are still incredibly grateful for any help we can get. All of the contact details are on the staff information hub, or if you can't find them, email one of us directly. Final thing I just wanted to pick up before we get into Q&A is vaccination. We are now up at about 85% of our staff having had the first dose, which is absolutely fantastic. And I need to say a big thank you both to the people working in the vaccination hub, but also the pharmacy team. And together, it has been an absolutely amazing effort. We are being asked to shift our focus to health and social care workers in Norfolk from next week. So my plea this week is if you are one of the 1,500 members of staff who hasn't had their vaccine yet, please book in and have it this week. It's about keeping you safe, keeping each other safe, and keeping patients safe. Okay, that's all I wanted to say, but I will now move into Q&A, and I am joined by Chris and Erica and Nancy, and Fran is here as well with her Speak Up team. So, Chris, I'm going to go to you first because someone's asked about the covered courtyard red rest area that we managed to set up before Christmas, and you and I went down and opened it with staff, and that was really nice. But it's being reported it's too cold and they're not getting deliveries of things like hand gel. Could we ask one of the estates team or some of the teams to have a look at this?
Yeah, thank you, Sam. In fact, I'll go down this afternoon and have a look for myself, because we did try and put the heating system so that each heater can be turned on by anybody at any time. So I've been in there a couple of times where all 6 heaters have been off, and it does get quite cold quite quickly. So I'll have a look at that. I'll get Chris over to go down with me, and we'll see if we can put on some sort of timer so it's on more often. And I'll have a look at the hand gel, yes, because we want people obviously to be able to use it in comfort, not be frozen and not be able to keep clean. So I'll do that myself this afternoon.
Thanks, Chris. And just on the cleaning issue, it hasn't come in on one of these questions, but some staff had contacted Fran, Nancy and I about this morning. Nancy, do you want to just say a bit about cleaning? And this came up in the connected session we had yesterday as well, didn't it?
So thank you very much, because actually keyboards and the mouse, kitchen areas, light switches, desks, they are all really important. But just so that you're all clear, keyboards and your mouse and telephones are trust responsibility. They are not included in the Serco cleaning or the touch point cleaning. So you'd have seen the touch point Serco cleaners wearing yellow polo shirts. It is very clear these normally fall in the bounds of the housekeepers, but I just want to say that actually CHED, the Children's ED, I think it was about a month ago, and it started out on Twitter, and our leadership team down there, and I mean all of them, that's allied health professionals, our advanced practitioner, support worker, our admin and clerical, ED clerk, the doctors, first thing every morning they do a wipe through. Everybody, I can't remember what they call it, but they've got a specific thing that they do, and every member of Children's ED team go through and clean all the keyboards, and then they do it again throughout the day. So I know that Joe down in Ched would show you his routine of how he gets the whole team. Doesn't matter what's on your badge, you have to pick up a Clinell wipe and you wipe everything down. So if you could engage your team to do that, because it's no one person's responsibility, it's everybody's responsibility. It's a little bit like the coffee room. If you've gone in to have a cup of tea or coffee, you wipe it down and then you wipe it down when you leave for the next person. So we're just having to do that everywhere. So, and if you're having problems with Clinell wipes, just make sure that you let the stores know and get more. But I think that you could really bring your team together here, but it is our responsibility to do that. Thanks,
Nancy. Erica, there's a question coming from Alan around vaccination, and he couldn't have the Pfizer vaccination because of an anaphylactic reaction and was told he could have the Oxford AstraZeneca vaccine. Are there any plans for the trust to offer this, or what should he do?
No is the straightforward answer. The clinical commissioning group is delivering the Oxford AstraZeneca, and the handful of staff that we have who are not able to have Pfizer-BioNTech will be offered Oxford AstraZeneca through one of the community vaccination sites. There are 3 Pfizer sites in the community and the rest are Oxford AstraZeneca. And if an offer hasn't arrived with that member of staff within the next week or so, I would expect primary care to pick that up. So the local GP should be able to pick that up. That's the agreement we have with the clinical commissioning group. We're not going to be delivering both. Every site is just keeping to one vaccine for simplicity because the processes are so different.
If I just come in, Sam, Erica, on that, yeah. I had a similar email this morning from somebody. I managed to sort it out with the GP practice, so I can't see who this person is on my screen, but if they would like to email me directly, I can certainly help speed that process up if they would like.
Brilliant, thank you, Chris. And just sticking with you, Chris, Adam has asked, can we say a bit more about the projections and when we might see the peak in Norfolk? Do you want to just say a bit about the latest modelling?
Of course, yeah. So as Sam pointed out, excuse me, there are some good signs south of us in Essex and towards London that things are starting to flatten out a bit. More locally, last week, the areas of the country that saw the greatest increase in incidence of COVID-19 was Preston, which had a 20% rise, and then Norwich, which had a 15% rise. So we are still very much, as Sam described, in the thick of this. There is a projection from the Judds Business School in Cambridge, which we've been using as a guide, which hitherto has been around about 95% accurate. That suggests that in the next week, we're going to see another 50 or so COVID admissions between now and the 25th of January. And then we should expect that to continue up until around about the 3rd of February at that rate. Thereafter, the effect of the lockdown, the fact that Christmas and New Year is behind us and that we're not bringing it up from Essex and London in the same quantities it was previously, we ought to see it start to drop off. There is a call I was on this morning, there is a hope that prior to the February half term on the 15th of February, it will be right back down to something around about the November levels. At the moment, though, I must stress that is a hope rather than an expectation. And we have all got to do all of the right things to make sure that for Norwich in this next couple of weeks, we don't watch it deteriorate to the point that Essex got themselves into a couple of weeks ago, where they had like county-wide Majax situation because everybody was overwhelmed. So we are having to make sure that all of our plans are sensible, that we carry on adhering to the right infection prevention control measures, even though we've now, some of us have had, 86% of us have had a vaccine, we still need to carry out the right and correct IP&C measures and maintain social distancing and all those good behaviours. if we stick to that in this next 2 weeks, I think we certainly should see that the peak for us is in that period of 25th of January through to 3rd, 5th of February.
Thanks, Chris. And there's a couple of people who've written in with various IT issues. I think someone is having a problem with COVID track and booking another appointment, and someone who hasn't received the COVID booking email. People just asking what should they do?
Email me directly and I'll sort it out this afternoon.
Okay, that's brilliant. Thank you. So Nancy, if we go to you, staff saying I think this must be members of staff working in the vaccination hub, that they don't know what shifts they're working. Someone spent a lot of time on Sunday ringing round to try and understand what their shifts are. This is causing extra stress. I think that might be a general point about shifts generally in the hospital. Is there anything we can do to help people with that?
So if it's about the vaccination centre, I know Helen Lloyd is coordinating that. So could you, if you email her, Helen Lloyd and Hilary today, and then you confirm up all your shifts if it's the vaccination centre. If it is the critical care surge or the wards, then I do think that you should contact Abby Kirkcaldy, or if you're on a particular ward that you like to go to, then obviously do it straight through the ward manager or matron. So essentially, someone else has asked about, is it just support to the wards at weekends and nights? No, it's 7 days a week, 24 hours a day, and it doesn't have to be a full shift. And if a middle shift or a few hours, 10 till 2 is what you can do, then I know the ward would, if you have a preferred ward, would definitely like to hear from you. We need all the help we can get, particularly particularly at weekends and nights, but in the weekdays too. So whatever you can offer.
Thanks, Nancy. Erica, someone's asked a good question, which we haven't discussed in recent sessions, about given everything that's going on, has there been a reduction in seasonal flu this year, or is it too early to tell?
Yeah, there has. Thank you. Great question. So yes, really good question. There's a reduction in seasonal flu, a reduction in norovirus, and a reduction in the common cold, and our staff sickness for all of those is at an all-time low. And that's of course because hand-face space protects you from almost all viral infections, and those are all nasty viruses that are partly transmitted by touch and your hands and also in your breath. So protect yourself from COVID, and you protect yourself from all sorts of other winter nasties, Sam. Yeah, absolutely.
Brilliant, thank you. And just sticking with you, Erica, a couple of people, someone's saying they're worried about having the vaccine, they're feeling phobic about it. Is there anything we could do to help? And then also someone saying around the Pfizer vaccine starts to work within 10 to 12 days. Does this mean staff who've had their first dose and feel comfortable can move from a green to a red zone?
So let's take the first one first. Lots of us hate needles. I really, really, really hate them. And I'm often on the giving end of large needles. So it doesn't necessarily mean that you're a big wuss. Full needle phobia is much more tricky, and we would need to talk you through the process we might put in place to support you to have your vaccine with a little more time and perhaps a quieter space. And we would do that in the vaccination centre. So again, you need to let us know if that's a necessity. We are about to release guidance for those staff who feel after a vaccination they would like to come back into a different area than their Rainbird risk assessment assigns them to. This will be voluntary, but it will be guidance. I've got 7 or 8 emails with a lot of text to check through this afternoon. We're working with Dr. Rob Hardman, who's our occupational health specialist doctor. Bernard Brett, my deputy, has been working very closely with him. We've been assessing the evidence with 2 of our academic consultants, working through what we think is a pragmatic and sensible approach to this. The straightforward answer is yes. Once you're vaccinated with the correct timelines, and all of that will come out in this guidance, and with appropriate PPE and appropriate cautions, if you would like to, we would welcome you to take a slightly less risk-averse approach than the Rainbird assessment originally gave a lot of people, because the vaccine helps downgrade that risk. So that guidance will be out in the next day or so. And it will mean that you can start to review where you're working. And we would hope that that will mean that some people who've been blue workers might become green or yellow workers, and some green or yellow workers might become red workers. But there is no compulsion. If you are on the high risk list and you feel too scared, we completely understand that. So this isn't about us as employers forcing people to do things they're not happy about. It's about giving guidance so you can make your own well-informed and evidence-based, as far as we've got the evidence, decision yourself.
Thanks, Erica. And Chris, between you and I'm not sure we can answer there's a couple of questions, but there's a couple of questions on laptops, and I don't think either of us are digital supremos, but I think we do need to take them away, because people are saying the EPMA laptops continue to be a massive issue. Medication rounds on the wards are becoming impossible, and that it's eating into registered nurse time, which is wasteful given how tight we are. So an urgent plea, and I can see Carol Cook, thank you Carol, has said that she will pick that up with digital health, but Chris, perhaps between you and I, we need to pick that up with Anthony. You're on mute, Chris.
Sorry, thanks, Sam. Yeah, absolutely. It would be helpful if we had somewhere to start. So if whoever originated the message points us in the right direction, again, we can dig into that this afternoon. We'll get someone down to start having a look and work from there.
Brilliant. OK, so if you could just email me or Chris with what area of the hospital you're working in, we will try and help you. OK, so Erica, perhaps we can go back to you. People are asking about the percentage of protection that having the first Pfizer vaccine might give you, as they've seen conflicting information. And I know there's a growing literature on this, isn't there? So would you be able to just talk a bit about that?
So as with anything that is rapidly moving and where the evidence is being garnered very quickly, we have multiple different bits of information on this. So at worst, the first dose gives about 68–70% antibody response. At best, it's above 90. The challenge for us is that the different cohorts where these were measured in the vaccination studies that were done ages ago are very small numbers. They're not big enough for us to extrapolate them into a big population. And that's why the Joint Committee on Vaccination and Immunisation has made the decision it's made, that with the resources we have, it's better to get the maximum number of people one dose and to slightly delay the second dose, because we know that herd immunity will have the biggest impact to slow the rate of infection down. The data is very complicated. I genuinely think it's likely to be closer to 90%, having looked at it all, that probably it's around 90% of us have antibodies. The bit of the missing piece of the jigsaw is that even those who don't develop antibodies appear to respond very differently to a COVID infection following vaccination. So your T cells, which are part of your immune response, are primed by the vaccination, even if you haven't developed antibodies. And to date, there is no evidence of anybody being hospitalised with severe COVID infection post-vaccination. So no one, and just to reiterate, no one across the world who's been vaccinated and waited the appropriate length of time. So if you catch COVID a week after, you won't have antibodies, but 3 weeks after vaccination, there's no evidence that anybody's been seriously ill with COVID. And that's why we think your T cells are primed. One other slight word of caution, we don't really know what this virus is going to do. And in virus terms, it's quite sneaky and quite agile. We've already seen it mutate repeatedly, and the mutations have resulted in a change to its structure, its RNA and its spike protein structure, that are still responded to by the current vaccine. The vaccine manufacturers, all of them, Moderna, Oxford, AstraZeneca, etc., they all are working on how to respond to further mutations should the need arise. It may be that people will need a subsequent booster to maintain their cover should the virus mutate further. And that's the subject of ongoing active work right now. So every time there's a change, a mutation, so the South American one is the big one that everybody's worrying about at the moment, everybody's looking to check how the vaccines will work. And I think the most important thing to assure everyone is that in the UK healthcare system, the brightest of minds and the brightest of people are making sure that we respond as quickly as we can and in as appropriate way as we can for the whole population. And I think we have to trust them and follow their guidance and their advice. Thanks, Sam.
Thanks, Erica. There's been a couple of questions in around car parking, which I've tried to respond to in the chat, but just to confirm that the Trust has leased the Triangle car park from the university until the end of March. That's the one on the research park, and that's available free to use for staff. And if you were a member of staff who was already parking at the staff car park on the Trust site, that remains free until the end of March as well. Someone's asked about the flat car park for £3 a day. That's not currently owned by the Trust. So we are trying to negotiate a lease on that, but those discussions haven't concluded at the moment. But we think with the combination of the staff car park and the Triangle car park, there should be enough space for everyone to park who needs to, and therefore people don't need to use the park and ride if they don't want to. Okay, I can see a couple more questions. So some more questions about the second dose versus the first dose and why we aren't currently giving people second doses. Nancy, shall I go to you, as we've just, I'll give Erica a break for a minute, but do you want to talk a bit about why we're not giving people the second dose?
So you'll know that we will literally do whatever we need to do to vaccinate and keep Norfolk people, certainly as our prime concern, as safe as possible. And that we, although the east of England got a bit of a battered really in about having slightly lower numbers than the rest of the country in terms of vaccination, not the Norfolk and Norwich vaccination hub, can I just say that? So if you think that we have vaccinated over 8,000 of our own staff, over 6,000, I would say easily for the over 80s, and some of those, many of those have had a second dose because right at the beginning we were allowed to. And Chris will probably tell me that I've over-egged it, but I think it was probably approaching 2,500, 3,000 care workers. I'm looking at his face, and it looks like to be about the right number.
That's fine, Nancy. Yeah, right ballpark.
Yeah. So, and but of course you'll know there was a central government edict. Look, get the first dose into everyone. And in fact, you know what, we got in trouble. So Chris Cobb, you know, he carried on going. There was no stopping. It was like a Duracell man trying to get as many second doses in before our hands became severely tied, so much so they were actually, when we got down to one dose, they actually severely castigated us for doing the last second dose. So we have really pushed the boundaries. We have also been asked to continue vaccinating because of our success. So not only we're vaccinating NSFT until they become their own hub. Thursday, we've been doing Community Trust, we've been doing Cambridge Community Trust, anyone really that we can support. But also we've been asked to also facilitate a further 26,000 vaccinations, but these are first doses. So the idea, going back to what Erica was saying, this is maximise the first dose spread. So because it gives that level of protection. Now, I know you might be sitting there thinking, well, surely the high risk, really high risk and clinically vulnerable staff, you could get them back to work if you gave a second dose. Well, Some of those have had a second dose when we were still allowed to, so we did do that, but actually we have had our hands tied. And I was just going to say to Chris, have I missed anything out that you'd like to add on that?
Thank you, Nancy. No, I don't think so. I think you've pretty much cleared it up. There's a number of people who have stopped me and said, could we please do something else? I think we've tried everything possible within our gift to try and get around this, but we've been basically told that we can't. And there is possibly an opportunity to review bringing it forward from the 12-week point at some point in the near future, but not quite yet. What the national team are saying, we all need to hold the line and get as many of the vulnerable and the people in the age group of 70 and above, and all the health and care home workers done first before anyone gets a second dose. We were, I suppose, a little bit lucky that we managed to get through 400 or 500 before we were told to stop. And because those 400 or 500 have it, it's invited everybody else to want it even more, I think. But you've covered it, Nancy. I think the door has been slammed in our face, and there isn't really now a mechanism to do it. And every one that we do, it instantly flashes up on a system called the Foundry system, and invites the national team to come down orders and tell us to desist. So it's a slightly uncomfortable position. It's not one that any of us wanted to be in. We all wanted to do that second dose. And as soon as we can, we absolutely will. We're committed to that. And now we know we can vaccinate all of our staff in a sort of 10-day period. The minute we get the go-ahead, we'll repeat the dose as quickly as possible.
Erica, you want to come in on that as well? Yeah, on mute.
That button. You think I've got used to it by now. Thank you, Sam. So just to assure everybody, we've already collated the list of order that will deliver those second vaccines in. So as soon as we get the green light, everybody working in COVID risky areas, so that's our emergency department, red AMU, and all the red wards will be first for their second doses. And we've collated the staffing lists, we've got them ready to go. We will be in touch as soon as we're able. It would help all the executive team if those of you listening could cascade this to your colleagues. We're inundated with requests for the second dose, and it would really help. Now everybody's understanding why, and that this isn't our choice. If you could cascade that through your teams, it would really help us. Thank you.
Thanks, Erica. Chris, can we come to you? Someone's said that could we help with food in the canteens? As I think this is because more wards have gone red. The food choices now for red people are not very good. I don't know whether we could pick that up with Serco colleagues and see if we could just see if there's anything we could do about that.
Yeah, we can't have that, Sam. So yeah, I'll talk to Velda this afternoon and see what else we can offer.
Brilliant. And Nancy, I can see you're replying to it, but I thought we should just mention Benjamin's question around flagging up that particularly at nights, staffing is getting very stretched. And is there anything we can do to try and help that?
Thank you, Benjamin. That's a really important point. I'll tell you, we are working tirelessly to recruit at pace, and I know nights and weekends have been incredibly difficult, and it is soul destroying for all of you. And this is hats off to every single one of our staff who've worked so valiantly with bank staff and any other staff just to keep the services going. And I know that it's scary. I think we need to be really clear. So what we've been doing is fast tracking 100 new support workers, so 60 in the next 2 weeks will be in. So the first lot are being trained this week and the second lot coming next week. We have gone, so I've done a second and third call to arms, and Norfolk, although I did say Norfolk needs you, I actually was very clear and said it's Norfolk and Norwich needs you. And actually we have been inundated with people that want to help in various different ways, whether that's giving out food, vaccinating. We have appealed to critical care nurses, ex-nurses, support workers, duly qualified midwives, allied health professionals who can come in and help on the wards. And we have also moved every specialist practitioner, so that includes the cancer nurses, liver nurse specialists, for instance, outpatients nurses, support workers, assistant practitioners, and hats off out there to, I must say, big thanks to the radiology assistants and assistant therapists have been fabulous on the wards. So, and it's really clear, so I have never deviated, nor have the nurse directors, nor has Tracy Fleming. This is a 7-day-a-week, 24-hour cover, and that actually we are in a national catastrophic situation. And if people were working 8 to 4, 9 to 5, actually not now. We need every single support that we can have, and that's what we've gone out and done. We had some response at the weekend. Some of our nurse specialists, now we're only doing 2-week waits in outpatients, came on and did flexible shifts at the weekend. And the other thing we've offered, because it really does help people come in, because they can do this, is a middle shift. And I've always said we would always have middle shift on the rota. It's very old fashioned just having early and late. So if somebody can do a 10 till 6, 11 till 7, 6 till midnight, 12 till 12, literally, I have said, work what you want. We pulled in people from the CCG to come on, so people who've got a background in end of life. So there are people coming, and that includes also military technicians who arrived yesterday. And QE and James Paget have also sent some support in terms of critical care nursing staff. But I think there is still more that we can do. And some of that has been training our admin, clerical, executive assistants, governance, supporting staff to be trained at meal times and to come and help feed patients. And so far we have about 70 staff of our own staff that have come forward to help on the wards. So these are some of the things we're doing. And also we agreed this morning, we are being very careful about risk assessments for some of our volunteers, but we are also bringing some of our volunteers back because we know that they can help on the wards with some communication and essential care. And finally, the relatives liaison team, if we think about how much the phone is ringing off the hook, the relatives liaison team, of which there are over nearly 25 people in that team now, from many walks of life in our organisation and outside, supporting the inpatient areas to be the connection between families, patients, handovers and ward rounds, just to help you. So Benjamin, I'm happy to look at any other possible solutions. I think I've pretty much racked my brain and been as flexible as I can. But if you've got an idea I haven't thought of, please contact me.
Brilliant, thank you. Now, I'm afraid we're out of time and I'm conscious people have got lots of other things on, but we will be back tomorrow with another half-hour slot in the lunchtime time, and we'll be back for our usual session on Connected at 12:30 on Thursday. So if your question can wait, we will be back and open to more questions then. If not, please email one of us and we will endeavour to try and help. So finally, we'll just finish by saying thank you to everyone for all of their hard work. We're immensely grateful at this time. Thank you.
Thank you, everybody.
Thank you. Thanks, everyone.